Hello, hello, and welcome to our Essential Wellness Empowered Life series. My name is Aisha Harley, and we are so grateful and happy that you are joining us today here in the Zoom room and also on Facebook Live. And greetings to everybody who's watching the recording at a later date. First of all, I want to let all of you know that our Essential Wellness community brings you monthly essential oil education. We've been doing this now for 8 years. This is actually the wrap up of our 8th year. And we like to do deep dives into important and relevant topics. We also offer monthly essential oil calls, and we have a team website and an amazing library of resources. And this can all be found at essentialwellness.life. And this is one of the amazing perks of joining our Essential Wellness community. You can find our schedule on our Eventbrite page at Essential Wellness, or you can follow Aisha Harley on Facebook, and everything is listed in our event sections. You can follow Aisha Alina on Instagram, and I also post all of our events there. Or you can find all the information in our Essential Wellness community Facebook page. So those are all the places for you to stay connected and informed of what we have going on every month, because you definitely don't want to miss any of our events. So we are so fortunate to have the wisdom and the expertise of today's presenters. This presentation was given in Portland on Monday, and it's incredible. It is packed with valuable information. It's very important. If you know anybody that needs this information after we do this live recording, please feel free to share. There's so many people that have issues with thyroid, so I've been excited all year for this presentation to happen. So I'm going to just introduce our amazing presenters, and we're going to get right to it. So first of all, we have Dr. Sean Shaska.
Yes, correct.
I've been practicing his last name, I have to admit. He is a naturopathic physician. He is an award-winning author and a licensed acupuncturist who has used a holistic and functional approach to treat thyroid conditions effectively for nearly 20 years. He has helped thousands of patients restore their health and improve the quality of their lives. For that, thank you. That's a lot to say. That's powerful, right? Yeah. And joining him, we have our beloved Dr. Mika Cora Carew. She is an ND and also a acupuncturist, a practitioner of Chinese medicine. And she brings her practice and love and knowledge of essential oils and the Chinese and Western herbs, along with the teachings of her Native American ancestral lineage. At a young age, she was taught to still her mind and listen to the medicine of the plants, which she is teaching us today. She uses the same stillness of mind to listen to the body rhythms of her patients. And she is also an author of her first book, Plant Spirit Medicine, which I highly recommend, using an ancient ancestral meditation to connect with the medicine of our beautiful plants. And it was published in 2018. So thank you both so much for taking your time. I know that you're both very busy. You're both coming to us live from your offices. And so I'm going to hand it on over to you.
Okay, thank you. All right, so couple things. One, both I and Dr. Carew will be kind of chatting back and forth, so we'll be kind of interjecting and putting our bits of information into this. When we're talking about thyroid conditions, most commonly we're talking about hypothyroidism, which is by definition low-functioning thyroid. And this affects a lot of people. We're looking at more than 20 million Americans have hypothyroidism, and many of these people are underdiagnosed or undiagnosed altogether. And this most commonly affects women, 1 in 8 women specifically. And this commonly tends to be more occurring the older we get. And as you can see in the slide here, iodine deficiency is common in other parts of the world, but in the US, we are most commonly talking about an autoimmune process in which your own white blood cells attack your thyroid. And this is called Hashimoto's thyroiditis. And a lot of our focus will be on that because it is so common. And so we'll be jumping into that bit of detail in just a second. But first, we want to understand the thyroid itself and its very important role it has on your health. And when we look at the thyroid gland, it's located at just below the Adam's apple. You can typically feel it in this area. And it has a butterfly shape, and its key role is producing thyroid hormone, which controls the amount of energy you experience and sets the rate of metabolism. And this affects every cell in the body, and with the exception of red blood cells.
Okay, so I just want to say, hi everyone out there, that this would be a good time to just grab an oil because Dr. Saska is so well versed in thyroid and thyroid function, and this might be new to some of you, and or so just grab an oil and sit back and take this in because we have a special treat of an ebook, right?
Yeah,
Yeah,
companion guide.
a companion guide that you'll get at the end of the talk. So thank you for joining us. So you can just take in the information and use your oil. I'm using neroli right now, but you can use anything you want. And okay.
All right. Yeah, and then I should also mention that we will be we'll be providing you with the slides as well as a PDF, just so I know I talk a lot. I know I've been doing this for 20 years, so this is all second nature to me, and this is obviously not second nature to you. So we have you covered, so don't worry about that.
Yeah.
Really, our focus is to give you a sense of what's going on and then provide you with some tools to make some positive change. And this slide here, I like to really emphasize this. As I said just a moment ago, the thyroid affects every function in the cell and every cell in the body. And so if there's a problem with the thyroid, you have to really understand that this affects literally every cell in the body. We're talking about whether it's your ability to see color as brightly, weight gain, energy, digestion, every cell in the body. It's a really huge impact. And the fact that it's such a huge impact affecting so many people, it's practically a epidemic, wouldn't say. And so really quick, I know I'm getting into the science. This is unavoidable. I just want to at least give you this overview. When we look at the thyroid, because it's part of what's called the endocrine system, it has its own feedback loop. And and this is going to tie back into some things we talk about relative to lab testing and things like that. The thyroid itself produces thyroid hormone, as I mentioned. T4 is the most common one. And it does so based on the signaling from the brain. And the brain responds according to the amount of circulating thyroid hormone. So it's a loop. And so when we think about that, we think about what can interfere with that loop. And that's going to be an important piece we want to talk about as well. And so when we look at that, you have the thyroid hormone production from the thyroid, and this can be impacted in Hashimoto's, of course, and we'll be talking about that in a second. But another piece to this that's very relevant is that because the thyroid produces T4 primarily, it must be converted into what's called T3. And that most commonly happens in the liver. T3 is what's biologically active. That means that's what gets into the cell. That's what triggers all the processes in the body, the energy production, the function of the digestive system, and so on. And because this conversion, in which a chemical process takes place, this happens in the liver, because so many people have liver issues because of our pollution and so on, that can be impacted as well. And that's a huge issue. And this is kind of a little bit of foreshadowing here. And so when we think about this, we want to be paying attention to liver function, how well you're able to detox and so on. So that's a really key thing. Do you want to add anything, Dr. Mika?
Yeah, I do. I didn't really go into detail on Monday's talk, but this is recorded. So The reason why we have the lemon down there in the corner is because we have some amazing citrus oils that we can use. And I have to help filter our liver. And we all have talk about our gateway oils, kind of what brought us into doTERRA and why. And one of mine was the lemon, because I was doing research on the liver and how to increase the liver filtration, because I knew that down the road, I would have to really think about how to filter out my own liver as because of hormones, because I knew that eventually I'd be going into perimenopause and menopause. This was 15 years ago where I started researching the liver. But then when Dr. Josie Schmidt introduced me to the essential oils, what I was specifically looking for was a citrus oil from the peel and the pith, which our doTERRA citrus essential oil is. All of our citrus oils that we have are from the peel and the pith. And what that does is it has a constituent called D-limonene. You don't have to worry about that. But what it does is it specifically goes into the perfect place in the liver. I'm not going to go into the physiology of that. I think I've said that enough on other Facebook Lives, where it targets this place in the liver where it pushes the toxins out so that you can get them out of your body through you pee and poop them out. So that's huge. Just a little goes a long way, right? So and I think we can get into how we take that later on, right, Dr. Saska?
Absolutely.
Yeah, but just know that any citrus oil that we have from doTERRA, you can use this and know in your mind, this is helping me filter out my liver. And you can see why that's so important later on.
Absolutely. And another important thing, too, we want to consider is the fact that this is a very easy and gentle entry point into detoxifications, because some people are very, very sick and don't have the toleration of the stronger detoxifications. So this is a great place to start.
Yeah.
And some people will get a little turned off by the fact that it's such a simple thing, but sometimes simple is the best answer. It really is.
Frequent daily doses. I'm just going to get it in now and then I'll say it because I think it's so important to so here's my water bottle. It's not fancy. And so right in here now, I have 3 drops of my lemon essential oil. I'm going to drink 3 of these today. And then the next bottle is going to be filled up and I'm going to do wild orange. And then the next one is grapefruit, because those are my 3 favorites. I want to move into lime, but because that's your favorite, right?
Absolutely. That's what I love to do.
And so that's how you would take it. And then you know that you're filtering your liver all day long. Okay.
That's very important. Another important component here in the process of T3 conversion, the next step is actually getting that hormone into the cell. And then furthermore, this hormone interacts with the vitamins in your cells. So that obviously implies that if you don't have enough of these vitamins, this includes the B vitamins, but also vitamin A and vitamin D especially, if you have deficiencies, then it doesn't matter how much T3 you have, you don't have the capacity to fully utilize it. So and then also too, when we have situations in which there's an injury or illness or inflammation, those receptors that bind with T3 can actually shut down as a kind of a mini hibernation as a way of putting the body into rest. And now the big difference between, say, what would happen in our more ancestral times and now is that we have chronic inflammation. The body's not really designed to deal with that, and so for that reason, a lot of systems get a little bit wonky, and it doesn't work as well. So nutrition becomes a really key thing in all this.
Yeah. I loved how you said our body goes into a mini hibernation. And so what I want to just say from my clinical experience of using the Long Life Vitality Pack is that, we need the nutrients. I mean, by now we all know that we are not getting the nutrient density in our food that our grandparents had, or even our parents. And so we have to, it's well known now that we have to take a really good nutritional support. And from my clinical experience, what I hear over and over again is that people make the biggest jump when they take this long life vitality pack. I know I did personally, with my thyroid function, and with my metabolic function. So these are, I want you to know, I'm here in the clinic. I'll see it all day long. People will say these long life vitality supplements are changing their lives, and it's like they could be at a plateau for a really long time, and then all of a sudden we get in the long life vitality pack, and boom, they're often running to even more support for their body and can feel it. And so give it some time too. It's not going to happen overnight, right? 3-6 weeks is a really good time to, just let your body get used to the absorption of these powerful supplements. And it's not too much. It's not a macro dose kind of thing. It's micro dosing. So you eventually need to get to the full dose.
Absolutely.
Okay.
So let's jump into and start looking at the actual types of thyroid disorders. And this is more of the functional approach to thyroid testing and looking at the bigger picture.
Mm-hmm.
So one of the things I like to talk about is very commonly conventional medicine practitioners don't always really catch all the different thyroid dysfunctions that are going on. And so because they don't give as much thought towards the symptoms that are going on, they typically only look at one test, and that test it's not a perfect test. And so because of that, a lot of times people are dismissed as having depression or something like that. And plus, I should add in that the concept of nutritional deficiency is slowly percolating into conventional medicine. In my conversations with conventional medicine practitioners, they're starting to pay attention to that. I find that nurse practitioners are a little more receptive to that than, say, the medical doctor counterparts. But still, I don't think it's really as in the forefront of their minds as it is with the naturopathic community. And for that reason, it's really important to, emphasize that important piece of nutrition, but also the fact that a lot of times, like I said before, the only test they usually run is the TSH test. And that is the signaling from the brain to the thyroid. It's basically saying, hey, you need to make more thyroid or make less thyroid hormone. And there are issues, especially inflammation, going back to that, as I just had mentioned, that can influence or hamper the effect of TSH. And also, when we talking about the lab itself, we find that the range that they use is, I think, a little bit too broad. And really, when we think about that, you'll see here on the slide, it says 0.5 to 4.5. And why I mentioned that is that based on research, they find that if it goes above 2.5, you're going to start seeing changes in the body. And most conventional practitioners only treat when the TSH gets above 10. So if you can imagine if 2.5 starts to create changes in the body, fatigue and things like that, 10, you're going to feel horrible. You're going to feel miserable. And another point I want to make with this is conventional medicine, the only answer that they're really looking to address is, do you need medication or don't you need medication? That's really that's what they have to offer. And as we've already stated, the deficiencies and the need for nutrition is, very paramount to all this. And so even if you do get the medication, there's no guarantee that you're going to actually feel like 100% better. You will probably see some improvement, of course, if it's needed, but there's oftentimes so much more that needs to be addressed. All right, I'm going to move to the next slide here. And when it comes to testing, what's important, we need to look at some other labs. And, I go into this in quite a bit of detail in my book, The Thyroid Fix. So I'm not going to really, go into too much detail. But the important thing is because TSH only measures the signal from the brain to the thyroid, you don't actually get the actual amounts of thyroid hormone in the blood, and that is important. And so for that reason, I do encourage a more expanded panel. And going back to Hashimoto's for a second, the thyroid antibodies are those markers that your white blood cells are attacking something, in this case, the thyroid tissue. This is measurable and this is relevant. So I do encourage people to get tested to find out what those levels are. You don't have to test it constantly, but you want to see where it is at, because there are some key points in those levels that if they rise above a certain point, there are some additional implications towards health. So we want to look at that. And again, I go through this in quite a bit of detail in my book.
Yeah, so in your book, people would then, it would say, I remember reading your book, and I want a big shout out to Dr. Saska for this amazing book, because it's simple, it's effective, and you'll get the info, you'll be able to understand the information. But so they would ask for certain thyroid tests, or how would they go about that?
Well, the thing that you really want to look into is, I mean, the TSH should be no problem. Every practitioner will run
Right,
that without question.
right.
But looking at what's called free T4 and free
Mhm,
T3 is very
mhm,
helpful.
mhm,
And in people with a lot of inflammation, looking at reverse T3 is also very useful too.
mhm,
And then likewise, the thyroid antibodies. And there's two primary thyroid antibodies we look at. One,
mhm.
one is called thyroid globulin antibodies. One's called TPO antibodies. And again, I go into this in great amount of detail in my book. So don't worry about the actual names of them, but it's there.
Okay.
And so again, really important to look at these. And you really, that way you can at least see where you're going with things. And again, also too, another side of this is that we can't ignore symptoms. So many practitioners look at numbers, look at the little test printout on their clipboard, and they don't look at the person in front of them. And that's the other side that really needs to be addressed.
Mhm.
All right, so now we've talked a little bit about that. Let's talk about the actual conditions, the disorders that actually occur in low functioning thyroid. So when we think about thyroid dysfunction, we have to think about whether there is a tissue damage, as in Hashimoto's, where the capacity to produce thyroid is affected, or do we have something where the conversion is not taking place because, say, a liver that's too toxic, or again, if there's any deficiencies. Likewise, infections can influence this, whether it's infections in the gut, whether it's infections in other parts of the body. And then, of course, inflammation, as I had previously mentioned, really, really key
Yeah.
in all the things we think about.
I just want to go over this. Then in the nutritional deficiencies, again, the long life vitality pack, and something I don't think I mentioned on Monday either was that, or maybe I did, I don't know, but I'm going to mention it here, is just about the anti-inflammatory properties that the long life vitality has in it. So it's so comprehensive by itself. I mean, we would recommend other things along with it from doTERRA, but just the long life, that's why it works so well. It's like this comprehensive pack of nutrient dense supplement with anti-inflammatories in it. And then you have the Terrazyme, which I highly recommend, to help uh, absorb the nutrients that you are eating, the food that you are eating. And then there's the Terrazyme, taking one in the morning, one with before each meal, and one before bed. And that kind of like inoculates your gut for the day. So it helps for the body to absorb the nutrients. And then the probiotic that we have, the PB Assist, and that also comes in a children's pack as well, because our children need they really need their gut support now more so than we did even when we were kids. And then the infections, this is so amazing. We have such an amazing tools. What I use in my clinic all the time is this little book called The Symphony of the Cells. And if you live in Portland, we're starting to do, thanks to Aisha Harley, these gatherings where we give each other the Symphony of the Cells. So you're all invited. I think the next one is December 6th, but she'll announce that at the end. And but this book by Boyd Truman has all these amazing protocols that you use with the oils. And there's a hormone protocol, and it'll say specifically up here for hyperthyroidism, hypothyroidism, but also there's, Dr. Saska knows this, the infectious disease protocol. So there's so many protocols that you have at your fingertips. I have this book at home, and I have, of course, it in my clinic here. So please use your tools. So I want to say I'm using these tools. We're all using these tools, and you can empower yourself by helping your thyroid with some of these simple tools that you can have at home. The GX Assist, the DDR Prime is one of my favorites, and the Slim and Sassy, but I think we get more into that later on, right, Dr.
Absolutely,
Saska?
absolutely.
Okay.
And what's really amazing about all this is that we do see with this protocol, we're doing layering. So, you know, the LLV has anti-inflammatory properties, the Terrazyme does as well, and then you just kind of layer and layer and layer, and you get so much more out of it.
Yeah.
Really important piece to kind of mention.
Yeah.
So we're going to dive into the hypothyroidism, because this is, again, really what most people are experiencing and they want answers to. And again, as I mentioned before, hypothyroidism means an underactive thyroid. So there's not enough thyroid hormone being produced to maintain normal body function. And so the common symptoms of hypothyroidism, fatigue is a big one. Weight gain is common. Constipation, feeling cold easily. And today is probably a very good example of that, at least in Portland. Brain fog's a really big one. Commonly, we'll see hair loss, hair thinning, and then the outside, the last third of the eyebrow tends to thin a lot. So we see that commonly in folks. And then we can see mood swings as well, because it affects the neurotransmitters, the chemicals of emotions, and then, of course, dry skin. These aren't all the symptoms, but these are the most common ones. And we do see some people actually have weight loss in Hashimoto's. So not everybody with hypothyroidism is going to necessarily have weight gain, but either one's possible. Weight gain is probably more common, generally speaking.
You know, when I started taking the Long Life Vitality Pack, I didn't notice my hair growth or my hair thickness, but my beautician did. And I had just been taking it for like 3 weeks, and she said, "What are you doing?" And I said, "Why?" She said, "Your hair is longer and it's way thicker." And of course, she's now taking the Long Life Vitality Pack. But sometimes we won't notice these things, and then our friends or our beautician will notice something like that. Anyway, so you might not notice, but it's happening anyway.
And with the hair, commonly, that's a very slow growing process, so it is more subtle. Most people notice when they start to reverse, oh, the brain's clearing up, I can think straight, more energy and things like that. Then they're often pleasantly surprised that the hair is coming back. So like, this is a triple win. We like it. All right. So as I mentioned, Hashimoto's thyroiditis before, again, the body's immune system mistakenly attacks the thyroid. It looks at it as it's something foreign. And so what ends up happening, it will actually destroy the thyroid tissue, and it often will lead to scar tissue. Now, an important thing about the thyroid, it does have the ability to grow back. It is a tissue that can regenerate itself, provided there's not a lot of scar tissue. And that's one of the reasons I most commonly will do a thyroid ultrasound on my patients, just to see where it's at. And then, of course, to make sure there's nothing else going on. Now, what typically causes Hashimoto's? There does seem to be a genetic predisposition, and we'll often see this running in families. And if you look back in your own family history, if you've got thyroid issues, if you see, and this, since it happens most commonly in women, you'll see, your mother, your grandmother, and so on, maybe aunts and so on. It does happen in men, of course. Let's not ignore the men. And matter of fact, an important little side note here is, if you are a female with thyroid problems and your father had thyroid problems, you're pretty much guaranteed to have that genetic predisposition. Of course, genetic predisposition doesn't mean that you're going to get this, but it does kind of can possibly be a cause, of course. And what happens in the thyroid, it often becomes enlarged, and this is called a goiter. And what happens is all these white blood cells get into the thyroid, making it swell. And so this will oftentimes be, sometimes it's subtle, sometimes it's really noticeable, but it's a very common thing to see in this autoimmune process. Likewise, very important piece, going back to the thyroid medication, is if you're given thyroid medication, its only purpose is to replace the thyroid hormone that is not being produced. It does nothing to address the actual tissue destruction. And that's why these protocols we're going to talk about in these supplements, really we're focusing on inflammation to reduce that, because inflammation is definitely a part of the autoimmune process. Really, really important to mention.
You know, you said something on Monday that thank you for saying it, and but that you said when you feel your neck, if you feel your thyroid, that means it's enlarged. Like
Yeah.
you shouldn't be able to really feel it.
Right. And what the common thing when practitioners are learning about the thyroid is that if you can, typically when you do a thyroid exam, you're like, is that the thyroid? Yeah, I think that's about the thyroid. That feels about right. It's kind of like, yeah, I think I got it. But if you could feel it, you're like, whoa, okay. And then sometimes you could spot a goiter across the room.
Yeah.
And that's much more obvious. But yeah, typically it's something you don't necessarily see, or feel, if it's normal.
I could see you looking around for goiters in a restaurant.
I embarrass my wife
Or
constantly.
at an airport. Oh my gosh.
Oh, absolutely. Oh,
Like
I
you're
am
like, oh my
totally
gosh,
there.
there's a goiter. Oh my gosh, there's a goiter. Oh, that's like
I'm like, should I get my card? Is that appropriate? It's like, TMI. I don't know.
oh, do it.
Yeah, right. I mean, yeah, I should. And so yeah, I'm kind of moving that direction already. But yeah, it is something that, well, the thing is, just a little side note, I won't belabor this too much, but when I see a patient and they're like, my doctor can't figure it out, I'm like, really? I saw you're sitting on the other side of the waiting room, and my clinic's got a big waiting room. I was like, who's the person with the thyroid? Is that my next patient? Sure enough. And so, yeah, that's the sort of thing that's just like, hello. It's like, it's an obvious one. So yeah. And again, that's a really key thing to be paying attention to.
Okay, before we go on, I just
Yes.
want to say you would be doing a service to them to give them your card.
Absolutely.
Because if they're walking around and they don't know it,
Right.
Yeah. So,
Yeah.
Okay.
Yeah. But so if I'm coming up and interrupting you during lunch, it's all for a good cause.
Well, you interrupted me when I was visiting at your house a while ago.
Right.
Taking care of I don't know. Anyway,
All good.
you were like, you got a thyroid thing going on. Oh, okay.
Right. Well, yeah, that's true.
Thank you.
Yeah. So getting into the root causes of Hashimoto's, as I mentioned, there's a genetic predisposition, and that itself is not enough to set this in motion. We do commonly see that a lot of people, when it sets in motion the Hashimoto's process, we see that there's a period of really intense stress that's often prolonged, and that can be a big trigger. And because stress is a lot to the body, and stress actually creates inflammation. And this is a measurable component where if you're having stress, we can actually measure it in your bloodstream, and that's an important thing. And likewise, the stress and other factors can lead to what's called leaky gut syndrome. And that's in essence, as we'll see here in the next slide, is a process in which we have what is normally a very tight group of cells that don't allow anything to pass through it. They become spaced out, and as you can see in the slide here, particles can get deep into the tissues and trigger an immune response. And we do see things like medications. Interestingly enough, a lot of the antacid medications can cause this. Taking Advil and all the NSAIDs is a trigger for this, antibiotics and so on. And of course, the stress. And let's not forget that, less than stellar dietary habits can also affect this as well.
Ooh, I'm going to talk about my coral analogy here.
Absolutely.
I love your picture. It's so perfect. So I like to think about the gut and talk about leaky gut as with this analogy. So you know, coral in the ocean, it's going like this. It's moving. It's beautiful. We're hoping that it's vital and it's moving. So we have that same kind of idea along our gut lining, and that's what makes up the gut lining. And there's these little, it's called the brush border. See how it looks like just in the picture that Dr. Sasika put up. It's beautiful. It's called the brush border, and it's like it's created by amino acids. We don't need to know that. It's called microvilli, and they're moving like this to help with contractility, movement, one, to help move the food through, but it's also for absorption and for the enzymes to live in these little spots for you to absorb food. So what happens is if you have inflammation, which is everyone has inflammation of the gut because of our diet and our environment, it starts wearing away of these beautiful finger-like projections. And what happens then is they turn into nubs. And then if there's nubs, there's less movement, right? And then the enzymes can't live in the nubs, and then you have leaky gut and you have lack of absorption. So one of the things that happens with the Long Life Vitality Pack, for example, one thing is that it decreases the inflammation, right? So then your gut lining, the microvilli, has a chance to start rebuilding itself again. And then if you add in, like you said, Dr. Saska, the enzymes, layering that on top, then you're getting the enzymes that you need for the nutrients that you need to be absorbing. And then you have the probiotics in there too. So you're getting a nice, you're helping to create a really beautiful gut lining.
Absolutely. Another thing that's worth mentioning is that part of your immune system is actually secreted like a thin coat by these cells. So if they're being impacted by, leaky gut, or their health is not robust, the capacity for your natural immune system to kind of buffer things out is negatively impacted. So that's another component to be aware of as well.
Mm-hmm.
And one thing I'll also mention is that, and this comes up a lot in people with Hashimoto's, is that people with celiac disease have what we call the ultimate form of leaky gut. And celiac disease is where you have the genetic predisposition where you cannot process gluten, and that's definitely a big factor. And we see a lot of people with Hashimoto's often have celiac, and it's not always the case, but there's a very strong overlap between the two populations.
Mm-hmm.
And other important causes of Hashimoto's, we can see viral infections being a big one. Of course, coming back to liver toxicity, environmental toxins. And then I should also mention too, with environmental toxins, that also implies the thyroid gland itself. As a matter of fact, the process of making thyroid hormone is a bit of a messy process. So it's really important that the thyroid can detox itself as well. So, and that's the key thing that we're going to see with a lot of these things we talk about in the protocol here. You're going to get those same effects.
Yeah.
Yeah.
Did I cut you off?
No, go ahead.
Okay. Yeah, I just want to really stress the fact, and it's probably in the protocols too, I can't remember, but the doTERRA cleanse.
Yes.
It's gentle, it's effective. We know that by doing these the cleanses twice a year, that we're helping to detox our thyroid, our liver, and our whole system. But I think knowing now more about the thyroid, you can think about, I really actually do need to do this 30-day cleanse twice a year, because the environment is not going to change. But what we have power over is what we're doing with our bodies. and you guys are empowered with this knowledge and information, not just of this talk, but from previous talks about how important it is to detox. So remember, detoxing with the doTERRA cleanse twice a year. We do that. We run detoxes at our clinics with the doTERRA cleanse. And know that we've done a lot of other cleanses. We've run a lot of other
Oh
cleanses,
yeah.
especially Dr. Josie Schmidt used to work in a cleanse clinic, and it was harsh. You can, if you know her, I mean, and you know, or you see her at a convention, you can ask her about all the cleanses she used to run. They were harsh. We all did harsh cleanses, and we love the doTERRA cleanse because it's so doable.
It's
And
excellent.
I also really think the 30 days is brilliant because you cleanse and then you rebuild. So there's the phases. Anyway, there's Dr. Josie and someone else we're gonna have a cleanse running in January. So I highly recommend it. Let's all do it together. Clear our thyroids. Okay.
Absolutely. Other things we want to talk about too, and we'll be getting into a few more slides
Yeah.
here, will be digestive tract infections can be a big part of things, along with the leaky gut. Food allergies are also another possibility in terms of causation. And these are just a few. I mean, there's a lot of other possibilities. It's a very complex topic, but these are the most common ones.
Yeah.
And first off, I'll talk about viral. And one of the most common ones is going to be Epstein-Barr. This is the one that causes mononucleosis. And generally speaking, the later on in life you have mononucleosis, the more likely you're going to have it lingering or coming back. And I should mention that Epstein-Barr virus is a member of the herpes virus family. So as such, it does have the possibility of coming back, as you'll see, like chickenpox can cause shingles later on in life. Some people will have a reoccurrence of Epstein-Barr, and that can really cause a lot of havoc in people. And certainly Epstein-Barr loves the thyroid tissue and can really settle in there, and that can be another cause. And some people, and some scientists actually think that that may be why the immune system's attacking in the first place, is that that's a factor. And so being able to do things to support the body in antiviral ways is appropriate if that's what's going on. Likewise, other common viruses, we'll see cytomegalovirus, which is another herpes family virus, hepatitis C, another virus that's common and often undetected in a lot of folks. And then even chickenpox is potentially a factor. That's not as common, I would say. I'd say Epstein-Barr by far is more common. And then even some more rare viruses called human herpes virus 6 is another one that's one we'd talk about. But I mean, the real takeaway here is Epstein-Barr, if you had it, I mean, to give you an idea, commonly I'll see patients in my clinic. They're like, "Oh, I had mononucleosis when I was in my sophomore year of college. Laid me out for like 8-10 weeks, something like that. Don't think I've ever felt quite right since." I'm like, there it is. And you really can look back in your history and see if that does apply. If you had it when you were like 10 or 12 or something like that, really not so impactful in a lot of cases.
I want to ask you a question here. So these kind of lie dormant in your body, right?
In
And
your
then,
immune system, actually.
Yeah. Okay. And then when you have stress, then it awakens, right?
Absolutely. Absolutely.
So go ahead.
I was going to say it's much like if you have herpes simplex virus 1, like the cold sores, you get stressed, you get a cold sore. Same sort of idea.
So what I found, because I'm doing Symphony of the Cells all day on people, is that I feel like my viral load has decreased because I'm doing Symphony of the Cells. Because I've had, Epstein-Barr, and I've had chickenpox. And so it's true, when I have stress, things start to wake up. I can feel it. But since I've been doing the Symphony of the Cells, I've noticed that my body, is able to repair.
Absolutely.
And rebound in a better way. So, and I know I'm doing it more than most, but once you do the Symphony of the Cells, if you're in Portland, come to one of the events. And if not just get the book and it's not hard. You can have a friend do it, exchange, or you just put it on the bottom of your feet. But I highly, highly recommend Symphony of the Cells for even just for viral infections.
Absolutely.
Okay.
Absolutely. So as we've talked already a few times here, liver toxicity is a big factor. Our environment is definitely impacted. And also too, because our liver is designed to detox our own chemical processes, the added burden of your environment, whether it be the food, the chemicals in food, pollutants in the water, in the air, and so on, that can just really overwhelm the liver oftentimes. And so, and then add on to that the fact that there are certain nutrients needed to actually trigger the detoxification process as well. So you actually you hit with a triple whammy ultimately. And likewise, and that's another, all the more reason to be doing detoxification programs. And the big attraction here with the doTERRA detox program is that it's so gentle in the body. You get the results without, they say no pain, no gain. I don't believe that. I think this is like no pain, all gain in this situation. I think that's really, really important. And I'm going to add one more thing.
No, go ahead. Sorry.
One thing is looking in your own home in terms of air quality. I do see a lot of people, especially in the Pacific Northwest, do have mold issues. And so really look at that. If especially in your household, if everybody in your household's got problems, you should be looking at, okay, what's in our environment that's influencing that, whether it's your water, whether it's your, is it your heating ducts full of dust, or is it mold, for instance? So that's an important piece to talk about.
Yeah. So I don't think we talked about this on Monday, but I think it's so important to be diffusing, and if you're in the Pacific Northwest, anti-mold things. And so one of the things I recommend for people who have chronic fatigue or anything that you've talked about, thyroid disorder, or know that they've had mold, is they're diffusing arbor vitae. DDR. I have them diffuse DDR. On Guard. I mean, there's so many. Melaleuca. All the essential oils are antiviral, bacterial, but for the mold itself, it's use that arbor vitae. Use the Melaleuca. Use the On Guard. Okay, that's one thing I wanted to say. And then the other thing is, we have got to decrease the toxic load in our homes. I'm so fervent about that. Like, there's things that I see really conscious people still having, is like, when I'm visiting, they'll have these like dishwashing pods, dishwashing. I don't know what they're, you guys probably know what I'm talking about. And they're putting that in their dishwasher, and they think it's okay. It's like, wait, you are a conscious individual. Oh, but I have no other option. Yes, you do. It's baking soda. I take baking soda and put it in my little thing, and then I have Melaleuca or On Guard or lemon, and I have that right at my sink, and I have the baking soda right at my sink, and I'll just take a couple spoonfuls. I have a little cup in my thing of baking soda, and then I'll add in maybe 10 drops in the baking soda to my dishwasher, and then I'm good to go. And I do the same thing with my my laundry detergent. So we've got to decrease. You've got to think, how can I decrease my toxic load for my thyroid and my liver? Because there's that, you have control over that. You have control about the soap, like the ones that say, the hand soap, the ones that say it's toxic free. It's not. If it smells that strong, you can guarantee that there's something in there, So so use the hand soap. This one's not filled up because it's on our, but please use your On Guard. It's helping the planet. It's helping save your liver and your thyroid. Okay, one more thing is that the mouthwash, because you talked about infections, right? Or do we get in that later? Is
Coming up to that, yeah.
okay, the mouthwash and the toothpaste are so important to decrease your infections. Okay.
Absolutely. And actually, that segues very nicely into this next slide. Uh, Digestive infections can definitely be a factor that can worsen leaky gut or trigger leaky gut. And common gut infections, including H. pylori, which actually feeds back to the mouth here, is that you'll often find that the gums will be a reservoir for H. pylori. And so then if you're doing things to maintain your dental hygiene, then you're reducing your risks of that. And H. pylori is a bacteria that infects the stomach specifically, and it is actually the cause of ulcers. And so if you've got a personal history of ulcers, it's H. pylori is the most common, it's pretty much the culprit. And so that can be a big trigger for Hashimoto's as well. Likewise, candida and other key bacterias and yeasts and even viruses can in the gut can influence Hashimoto's as well.
Mhm.
And there we go, the oral cavity, dental infections, certainly untreated, you know, bacterial infections in the mouth can definitely be a factor, and you have control over that, the mouthwash, toothpaste, good dental hygiene. Likewise, any person who has, like, say, an infected root canal, that can be another source. So anything you can do to strengthen your oral defenses would be an appropriate course of action as well. And then, of course, food allergies. Certainly, that is another thing that is common for a lot of folks and this is kind of a cyclical component because leaky gut is the most common source of food allergies. And so it is kind of like this vicious cycle in that sense. And so as such, we commonly see the top three are going to be gluten. Gluten's a big one in Hashimoto's. Dairy is another common one, and soy is a third common. These aren't the only ones, but these are the most common. And again, these food particles get past the surface cells of the small intestine in a leaky gut scenario, and this will again trigger an immune response. And as I mentioned before, the celiac disease is another common factor as well. So looking at that and doing things to identify that is important. And then, doing everything you can to heal leaky gut is really vital as well.
So like the Long Life Vitality Pack and the Terrazyme, one in the morning, one with each meal, and one before bed, for example, right?
Absolutely.
Mm.
Absolutely. Yeah. And certainly kind of doing some detective work and figuring out what foods are really useful to avoid. And then again, I'd say again, the most important one is going to be gluten in Hashimoto's. And one thing I'll mention just briefly here is it is always wise, if you're going to go gluten-free, to be tested for celiac disease just to make sure you don't have it. And because sometimes you may not have the symptoms of digestive symptoms that are so common in celiac disease. Sometimes it's silent celiac, which oftentimes the only symptoms you do experience are just an increased risk of cardiovascular issues later on in life. So it's important to look at, and celiac disease is increasing over generations. So the frequency of it occurring genetically is increasing as well. So that's another thing to be aware of when we talk about food allergies or reactivities. And talking very briefly about hyperthyroidism and what this is, it's another autoimmune condition. It's very different from Hashimoto's in the sense that it produces too much thyroid hormone. So you get almost the exact opposite symptoms: weight loss, anxiety, rapid heart rate, and so on. It does have similar causes as we mentioned here. I do mention it just because some people do ask about this. So I just wanted to kind of at least put this into your awareness. If this is the case, it's important to work with a healthcare provider who really knows how to treat this. And there are natural ways to address this, by the way. Now let's get down to the really good stuff. And that is treating the thyroid naturally. And this is using all our nutrients and the things we've kind of been hinting at. We're going to go into a lot more detail. So before we do that, I've got to mention medication. Again, most conventional practitioners are, the simple question for them is, does this person need medication or not, or no medication? And when they do give medication, they most commonly give what's called levothyroxine, which is a T4 replacement. And it often helps a lot of people when they need it, but a lot of people find that it's not as effective as they would hope. And so there are other medication alternatives, the desiccated thyroid, which is a combination T4, T3. This is often gets better results. But again, neither of these options address the underlying cause or the actual autoimmune process of the thyroid condition, nor does it address any of the nutritional deficiencies, and which is the main purpose for this whole presentation is, what are the things that you can do to get yourself feeling better? Because even if you're given medication, you might feel 40 or maybe 50% better, but you're not all the way there in terms of where you should be and how you used to feel. So that's an important distinction. And that's why we're kind of really focused on all these things. And exactly what I said there. And then again, we want to address root cause, restore normal function, and do so without, adding any additional toxins, and, by getting to the root cause and, healing the gut, healing any underlying illnesses or infections, and reducing inflammation. That's all key to this process. Diet's a very important component. As I mentioned, some of the very basics that should just be right out the gate. The more processed the food is, the less nutrients are in it. And if the food is fast, it's not good for you. Simple as that. And then I do see commonly, and I constantly look at people's diets in my practice, is most people don't eat enough vegetables. They just don't. And that's really, really important. And likewise, as I mentioned before, removing gluten is important. Again, it's always wise to be tested prior to doing that so you can see what's going on. And then high quality proteins is another factor. A lot of people see benefit from the autoimmune paleo diet. It's not the only diet out there, but it's often what people turn to, and they often do feel better. So that's a consideration. And I do believe we have a resident expert in terms of diets in the
Yeah,
paleo world.
so yeah, just a shout out to Dr. Louise Rose of Rose Cabinet. She used to be a chef. She's a physician, naturopathic physician, and one of her focuses, not all of her focus, but if you really want to hone in on what is a good diet for you, for your health and well-being, contact her. I know she does an online course as well. I highly recommend it. It's totally worth it. As you see, nutrients in diet is so important. And one diet does not fit all, but she can figure it out for you. And if you live in the area in Portland, she's at Rose Cabinet, so you can make an appointment with her.
Absolutely.
Yeah.
All right, so the steps to restoring thyroid function, we want to calm the immune system if there's an immune issue going on, reduce inflammation, get those vitamins and minerals back to where they need to be, and of course detoxify the liver, the intestines, and I should say the thyroid, healing the digestive tract, and of course naturally, very important, improving thyroid function. So these next set of slides are going to talk all about those specifics. So again, calming the immune system and reducing inflammation, we actually find that things like turmeric, boswellia, and frankincense do all of that. So really key piece here. And again, you can see here we have a couple, and these are just few of many options that can address this. You have the deep blue polyphenol, which has lots of turmeric. And then again, the Terrazyme we talked about is another.
Yeah, just short, because I know that it's been an hour, is that the deep blue polyphenol. So if I know that I said that there's good anti-inflammatories in the Long Life Vitality Pack, but if you're having inflammation or you're having any of these symptoms, like I take 2 deep blue polyphenols a day in addition to my Long Life Vitality. And some people might say, oh, that's a lot, but I take a whole lot more and I feel awesome. If you knew my schedule, then you would be like, wow, she can do a lot. And it's because of these supplements. But so the Long Life Vitality Pack and the Deep Blue Polyphenol, and let's keep going.
Absolutely. And then, I think you had hinted at this earlier, the symphony of the cell is a big player. You're obviously a big fan as well with that. And certainly that's, I think, an important thing. I don't know if you want to add more to that.
Well, no, I just want to say, let's say that you're overwhelmed with the amount of oils that he has in the inflammatory protocol. Don't worry. Just go, you could use any oil and they're going to be anti-inflammatory. But we did put Aroma Touch is amazing. It's an amazing anti-inflammatory. And then you could layer that Aroma Touch, then Deep Blue, then Siberian Fir, apply to the spine. If you can't get to the spine, put it on the bottom of the feet. If you have those three, you're doing a really great job for yourself.
Absolutely. And again, simple is still powerful in these
Yes.
cases.
Yeah.
And then, of course, replenishing vitamin minerals. We've talked about that. As you can see, there's, the LLV is powerful in its own right.
Mm-hmm.
And for that reason, we actually, for those people who are more sensitive, it's better to kind of start with like the half of the recommended dose for the first month. And then you can increase the full dose thereafter if you are a more sensitive individual.
Right. And I just want to say Dr. Josie Smith, she knows the Long Life Vitality so well. She's picked it apart. And she did a great webinar on that. It's in our files in our library. And so if you want to have a deep dive, I think she calls it deep dive into the Long Life Vitality Pack, go to that and listen to that webinar. It's chock full of amazing information. And then she'll give, even if you can't do the half dose, she'll give a protocol on how to go even before the half dose. So don't worry, you can get it in the library.
And then, of course, detoxification. We've talked about that many times. Key thing is to get rid of the known sources of toxins, whether it be, cleaning products, which is a big source of that. Skincare products, a lot of crazy stuff in skincare products. If you look at those labels, you're going to see a lot of weird chemicals. That's probably chemicals you don't need. Likewise, water and air filtration. I don't think that's optional anymore. I use a very robust air filter system and very robust water filtration system in my home. I don't want to chance it.
Yeah.
Just don't.
Right.
And then likewise, we have a number of protocols here that are useful. Zendocrine, dry skin brushing. I know you're a fan of that. Maybe you want to speak to that.
I am a fan of that. It's super, super simple. I mean, you can get online and watch YouTube on how to dry skin brush. I do it very quick. So I just, before I get in the shower, I actually don't use the brush. Like some people like the brush, but I think that I'm just too intense anyway to use a brush. So I just use a washcloth and gently, vigorously, I'd have to say, go up the inside of my legs and outside of my legs and my whole body, inside of my arms and up, and then I jump in the shower. Do I use the Zendocrine? You guys, I change it up. I can't say that I always use the Zendocrine. I have an array of oils that I use on my body before and after the shower. Zendocrine essential oil is one of them, though. This is, I could go on and on about Zendocrine, but it is so well scientifically thought out, and the combination is amazing. But we need to move on. So just trust us on Zendocrine soft gels and the Zendocrine oil.
Absolutely. And then, of course, you'll see there we do have the recommendation of using your citrus essential oil of your choice in your watered and filtered water, of course, there. And with that, too, I know that, using at least 5 times a day, drinking 5 times a day is important. And that's not a lot of water. I just want to point out you do need more. But, if you're just starting from the very basics and not getting enough water, this is a good place to start. And then you can kind of reach that goal and keep going higher. I like to do 16 ounces of warm water, and I put my lime essential oil in there, drink that first thing in the morning before food. Just kind of gets things going and just gets the metabolism starting in the morning. And I think it's really important.
Yeah, if you've been tuning into these webinars, I usually say 1 quart of water per 50 pounds of weight.
Yep. Hydration's important.
Yes.
And then healing the digestive tract. We've talked about this, and we've identified that it's a big issue. There's a lot you can do to address that. And I do feel like the detox does a very good job of that. I really do.
Mhm.
And again, the Terrazyme, again, it's simple, but it's powerful. And with Terrazyme, when you're taking it away from meals, you're getting anti-inflammatory effects. With meals, you're breaking down your food better. And that's important because so many people don't break their food down well, and it can sit in the intestines and cause all kinds of trouble. That's an important thing. PB Assist, again, very useful. GX Assist, very helpful as well. And that's something you'll commonly use in that detox protocol. A very important thing. I found that to be very powerful for myself.
Mhm.
Really, really important. Um, and then improving thyroid function. We come back to DDR prime, really, really helpful. And, that and the deep blue polyphenol, really helpful for uh, getting the thyroid to reduce the inflammation and helping with function overall. And that, along with everything else, I mean, because it all ties in together. I think that's an important thing.
Yeah, and I don't know if so how I take it is I take, because of my genetic family history, I take 2 of those a day.
Right.
So, it's
Yeah.
a great healer and to make sure cellular repair.
And I will add in just a clarification on this slide here. It should say here 1 cap daily. After I'll back up and say that the diffusing of the DER is appropriate if you're a very sensitive individual and you do have, if you're very chronically ill, diffusing that's helpful, and certainly if you have any mold exposure. And then, assuming you've done that, adding the actual prime in, the actual capsule in the second month is taking that once daily. And then after that, it's 1 cap twice per day, I should say,
Yes.
um, every month thereafter. And that's kind of what I call the cruising speed.
Yeah, love that.
And then this is an interesting thing that was developed here between Dr. Josie Schmidt, Dr. Mika Crew, and my contributions as well, is this topical blend. And this is in that guide that we'll talk about the specifics of that. But this is something that could be applied directly to the thyroid area and can improve functionality as well. Want to add to that?
Well, I'm all about topical use as well. So that's something that I have in multiple places in my house. So or in my bag. So for instance, I have one on my sink. So I get out of the bathroom and a blend like this or this one is I'm just applying it to my thyroid. And then I have it in my case that I carry with me at all times. I feel like it's like frequent daily doses again of just taking care of my thyroid, and in a simple, easy, great smelling way, right?
Absolutely.
Yeah.
And we have an ongoing study going on, seeing how people respond. I found patients who have thyroid nodules, and we're seeing what the effects are with this. We're still observing. It's going to take a while to get the final details,
Mhm.
but certainly with the frankincense and its power, and the power of myrrh can't be denied in terms of
Yeah.
the benefit with that. So we're actually at the end here. Now, one thing I want to point out is, yes, you can text to get this guide, but we're going to be adding links to you can click and download, which is probably more practical for the online purpose. But if you wish, you can certainly text and get the guide. And what this will do is you'll click on the link and enter your information. Then you'll get the guide as an email, and then also you get a follow-up email. Will have the slides in it. So that's really the key with all that. And now I guess it's time to question and answers.
Yeah, before we get into question and answers, I just want to thank you, Dr. Saska, for your time and your expertise.
Absolutely.
I really appreciate it. Thank you for this great presentation, and it was laid out in such a simple, informative way. And so I just really appreciate you and how you're helping people with this like chronic, rampant situation we have going on the planet. It's not going to get any
Absolutely.
it's just going to get bigger. And then Aisha, I just want to say thank you for having this platform available for all of us and for our team. It's so important in these times, right? To have a place where we can gather and learn from each other. I've learned so much from you, Dr. Saska, over the years, and learned
Likewise, likewise.
definitely so much from you, Aisha, as well. So there we go. That's all I wanted to say.
Thank
Yeah.
you both so much. Again, this is such a valuable presentation. I know that it's going to serve so many people in the coming years, actually, as it lives in our library. So thank you both so much for just pouring your love and your wisdom and your experience into our community. I almost get choked up. It's just so valuable. People need this, desperately need this information. And I feel like we're super blessed in Portland. It's easy almost to take for granted the amount of information and access we have, but it's really not the case for a lot of people around the world. So I'm just so grateful that we're able to share this information far and wide through our community. And I also just too want to stress what Dr. Mika and Dr. Shaska say about the importance of the small things that you do every day. It's the drinking the water, the detoxing your home, the looking at your food source, the taking your supplements. These self-care practices, in my opinion, have become non-negotiable. Yeah. And if you want to live a long and healthy and joyful life, these are all things that all of us can do, whether you have a thyroid issue or not, to remain healthy. And one thing Dr. Mika said on Monday was act as if, you know, and act as if that one day that illness might be creeping in. So start addressing it now, even if you feel like you are healthy, because the toxicity and time tend to wear our bodies down. So the only one question that I am seeing, it's a simple question from Raina, is when applying oils, do you apply them to both feet, or is it okay just to put them on one foot? And if anybody else has any questions, go ahead and type them in now. Otherwise, we're going to go ahead and wrap this up since we're a little bit over time.
Yeah. Well, if 2 feet are available, I would say use both your feet. If one's only available, you just use that one.
Yeah, simple enough, right? Yeah. Just get the oils on.
Yeah.
Absolutely. Yeah.
Anywhere you put them, just get them on.
Yeah.
So go ahead and move to the next slide.
All right.
So if any of you are joining us and you do not yet have your own doTERRA wholesale account, you can actually go to the next slide. The very best way to get your products is to open your own wholesale account. It's super simple. It's going to save you a ton of money. It's going to make you eligible for free products, and it's going to give you access to our Essential Wellness community. We have an exclusive Facebook group. We have a website that we've referred to in this webinar, and we have years of webinars such as this of all kinds of different topics with different experts speaking. So if you have other health issues or you just want to learn more about essential oils, we also have a library of team calls. It is a super valuable resource that will keep you busy for a long time. There's so much to learn. So all you need to do is reach out to the person that invited you to this webinar. If you do not have a connection and you just found this online, please, you can message me on Facebook, and or you can email us at info@essentialwellness.life, and I will help reconnect you to kind of the source of how you found this webinar and or help you get set up. And also today, which is actually Thursday, November 21st, we are in the middle of BOGO week, which is if you buy one, you get one free. So we have some amazing deals. So if you are thinking about enrolling with doTERRA, today is the day to get started. So I'm not going to go over all of the deals right now, but again, reach out to the person that shared this information with you, and they will get you set up. And these deals are, the deal we have today is a 24-hour deal. So don't delay. And thank you both again so much for your time. This recording will be posted on our Essential Wellness website in a few days. It takes a couple days to get that up. And I hope all of you have a beautiful day. So thank you so much.
Thank you, Aisha.
Thank you.
Dr. Saska.